Are you interested in catching COVID-19? No, I didn't quite think so. So let me give you a few tips that might keep you safe during all this pandemic stuff going around. I'd like to take a few minutes to speak about proper use of PPE and social distancing. You know, if we do use PPE and social distancing correctly, like if we were to use our gloves correctly, our masks correctly, and everybody kind of stay away from each other, this virus would maybe not go away but dwindle, and maybe it would save a few people, especially like elderly people, those with chronic illnesses and things like that. And since this virus has come out, we've found out a lot more about it. It does seem to keep mutating, and unfortunately that's just how viruses work. But you know, with the use of PPE and social distancing and things like that, we might be able to reduce the spread and save a few lives and just keep everybody a little bit healthier until we can get this vaccine rolled out, which they are working on, which is great. I think it should go through a few trials first, because they're really trying to roll it out quick, and they're not necessarily testing it. But that's not what I'm here to talk about. But regardless, my concerns. So this virus has the potential to, you know, hurt a lot of people, make a lot of people sick. So not just for us, but if we wear PPE, then you know, we could potentially save some of our loved ones. Maybe not even people we don't even know, who are elderly, who, you know, we might spread it to without even knowing we're spreading it, because a lot of people are asymptomatic. Younger people, healthy people, they're asymptomatic. They might even think they have a cold. You know, it's hard to tell what you got, because it has a lot of the same symptoms as the flu and the common cold. So this virus is extremely contagious. They used to think that there was a high probability for surface transmission, which they're kind of going back on that now. Surface transmission is still possible. Obviously, somebody's sick, wipes their nose, touches something like a door handle, doorknob, handrail, anything. The checkout, the little debit card machine on a checkout, you know, gets their snot or even little droplets of this virus on that surface, and somebody else goes and touches it, especially if they have a weak immune system or something. They touch their face, touch their nose, touch their eyes, then there's a probability of them catching this virus, and you know, that's not cool. So you know, with that being said, we need to watch what we're doing there. We need to use hand sanitizer, gloves, masks, things like that. WebMD states it can live up to 5 days on metal and glass, 4 days on wood, and 2 to 3 days on plastics. That was from WebMD. That's a long time, and not saying that anybody who comes into contact with that surface is going to catch it, but there is a possibility, especially like we said earlier, if they have a low immune system function or, you know, things like that. So we still are in the middle of this pandemic. There's still new cases. I work at a prison. There's new cases almost every day. We have quarantine units and things like that. So it's still a very real thing. And I don't know if people have kind of forgot about it or just don't care or think, well, I probably already had it, I'm fine. It's not always the case. How about wearing a mask? These mask mandates and things like that, yes, they're inconvenient. Yes, they kind of suck. But at the same time, for people who might have it, who are coughing or sneezing or anything, it's going to stop the spread, because you're not, you know, shooting it across the room when you cough or sneeze, because it travels through aerosol droplets, and it can travel, you know, longer than 3 meters or further than 3 meters, according to the World Health Organization. And I mean, that's pretty far. If you cough, it goes across the room, because 3 meters, I mean, that's more than 9 feet. So we're told to social distance 6. So anyway, and then the last thing is social distancing, which could be the most important. You know, just kind of staying away from people, not being all touchy-feely with people, not touching things that you don't have to, not touching your face if you don't have to, staying away from everyone. You know, it used to be a custom to go and shaking somebody's hand, and now maybe it's not such a good idea to do that, especially if you've got some people at home that might get sick easy, or you get sick easy. You know, you might want to not do that so much. Don't give everybody hugs you see and things like that. So a lot of people aren't following the guidelines, which sucks. It's been a while. You know, it's been months now we've been dealing with this. You would think people would try to follow these guidelines, and we can still turn it around, but I don't know. Unfortunately, you know, people are going to do what they're going to do, and until everybody wakes up and realizes, we've had all these mass protests and things like that, people in large groups, and I feel like it has flared up a little bit, not as much as I thought, but you know, it's just, you got to stay away from that kind of stuff. So anyway, what can we do? Wear your PPE, gloves, mask, you know, all that stuff. Social distance, and even if you just wear a regular face covering, bandana, whatever, just something to stop that cough from expelling. They are, you know, working on a vaccine, but again, there's nothing there. We don't have a vaccine yet. So you need to keep yourself and your loved ones as safe as possible by following these guidelines. And then, you know, it can affect young people or old people, mainly the elderly and those with low immune system function or compromised immune systems, but it can affect everybody. And then if you don't do it for you, do it for someone you love. Do it for someone you care about, your grandma, your grandpa, your sick cousin, your sick brother or sister. So that's it.